towards SDG 6 and bring a change in the life of vulnerable society. So wish you all the best. Thank you.
Bonjour, je m'appelle Maeve et je suis basée à Madagascar. Je travaille avec Happytap, une entreprise sociale axée sur l'hygiène des mains. Bienvenue à la conférence de l'UNC sur l'eau et la santé cette année 2021. C'est la première fois que je participe à cette conférence, mais je suis ravie d'être ici. J'ai hâte de découvrir les recherches de mes collègues sur le lavage des mains comme pratique importante pendant et après la pandémie COVID-19. Bienvenue!
Hi, this is Anna Cucurullo from DevWorks International coming to you from Washington, D.C. Welcome to the 2021 UNC Water and Health Conference. I've been attending the conference since 2017 and I've always really enjoyed the frank and open discussions around WASH strategy and project design. Through this information sharing, we at DevWorks have been prioritizing putting local partners at the forefront of technical design and project implementation. Looking forward to another great year of discussion, learning, and can't wait to see you all.
Welcome to the 2021 UNC Water and Health Conference. My name is Anna Murray, and I'm from Charity Water. Our office is based in New York City, but I'm joining from the beautiful state of Maine in the northeast corner of the US. This is my 9th time attending the conference, and I'm looking forward to another great year and seeing you all virtually this week.
Hello friends, this is Digvijay Day. I work for ISUS and I am based in Bangladesh, which is one of the most densely populated countries in the world. This is the first time I am participating in the UNC Water and Health Conference, and I am looking forward to learn a lot of things on policy and practice. Let me speak in Bengali. তোমাদের 21 ওয়াটার অ্যান্ড হেলথ কনফারেন্সে সবাইকে স্বাগত। ধন্যবাদ।
My name is Shauna Curry, CEO of COST, Center for Affordable Water and Sanitation Technology. Welcome to the 2021 UNC Water and Health Conference. Our team has participated in the last several years, and what we learn helps us serve our clients worldwide. Enjoy the conference.
Hello, my name is Jacob Niemeyer. I am the founder and executive director of a young but growing nonprofit by the name of Veraqua Veravita, which is Latin for True Water, True Life. And our mission is to combat the global water crisis and bring clean water to communities in need in developing countries. And I welcome you to the 2021 UNC Water and Health Conference.
Day one, afam bụ John Abumchukwu. Abụ m onye otu Vuma 8 n'obodo anyị Nigeria. Otu anyị bụ otu na-agba mbọ ịfụ na ịdị ọcha ga-adị n'gburugburu obodo anyị. So eji m ohere a wee na-asị unu nnọọ n'ime omume nke arọ a bụ arọ 2021. So nnọọ nụrụ nne anyị na-anabata mmadụ ncha nnọọ.
Hi, my name is Clarissa Brocklehurst and I'm an adjunct professor at the Water Institute at the University of North Carolina. I'd like to welcome you all to the 2021 UNC Water and Health Conference. I've been attending this conference since it began, and I've watched it go from strength to strength, becoming a great community, even weathering becoming a virtual conference. I hope you all really enjoy the proceedings.
Welcome, everyone. I'm Aaron Salzberg. I'm the director of the Water Institute within the Gilling School of Global Public Health at the University of North Carolina in Chapel Hill. Thank you all for your patience. We are having some technical difficulties and we should be adding more and more people as we go along. There is a link in the chat site now. That's the preferred way to get in. So if you can go ahead and click on that link, hopefully you'll be able to get in and join the rest of us. Again, it's my great pleasure to welcome all of you to the 2021 Water and Health Conference. And many of you have been to our conference in person, but some of you haven't. So before we begin, we wanted to acknowledge some of our own history. The Gilling School is located in the beautiful Chapel Hill campus of the University of North Carolina. And long before the campus existed, there were teachers, students, elders, and youth inhabiting the spaces that we enjoy today, trading knowledge and goods with one another. North Carolina is home to the Occaneechi, the Lumbee, Kahari, Haliwi Sapani, Eastern Band of the Cherokee, Meherrin, Tuscarora, Sapani, and Wakamasuan, along with many other indigenous peoples living in both tribal homeland and urban settings. In fact, North Carolina has the largest indigenous population east of the Mississippi River. We acknowledge and give thanks to the first peoples of this land and their descendants. It's also important for us to acknowledge and honor the crucial role of enslaved people in the early days of this campus. Enslaved people were sold as escheated property to help fund the establishment of UNC. And the labor of enslaved people built UNC Chapel Hill and undergirded its operations until emancipation. We acknowledge and give thanks to the enslaved people who built UNC and their descendants. May we build upon the memories and goodwill of all who walked and labored here before us with truth, integrity, and honor. And with that, I'd like to introduce Cody San, who will help be making some of our announcements today. So over to you, Cody.
Hi, everyone. Welcome again to the 2021 UNC Water and Health Conference. My name is Cody San, and I'm the Administrative Assistant for the Water Institute. I'd like to begin by sharing that we will be having interpretation services for today's plenary, as well as all of the following plenaries for the rest of the week. Thanks to the support of the Bill and Melinda Gates Foundation, we are able to offer interpretation for Arabic, French, Hindi, Portuguese, and Spanish. So thank you again to the Bill and Melinda Gates Foundation for making interpretation possible. We'd like to invite you all to join us this afternoon from 12:15 to 1:15 Eastern Time, and this afternoon from 3:30 to 5 Eastern Time for networking with colleagues and sponsors. During the lunch events, we will be having the networking events on Pathable via the Talk Now feature, and later in the afternoon, we will be having it on Remo. Instructions have been sent to your email on how to access Remo, as well as they are on our conference website. Today, following the plenary, we'll be having 4 different side events and 4 different rooms with 4 different topics. After that, we'll have a short break and we will go into our lunch events. As I mentioned previously, there will be sponsor booths via the Talk Now feature. There will be as well 5 other different lunch events, so please tune in for those. After that, we will go into verbal presentations in 4 different rooms with 4 different topics, and you will have the ability to jump from one room to another. And we are very excited to also have posters this afternoon. We will also have 4 different topics in 4 different rooms, and you will also be able to go from room to room if there are multiple different presentations that you would like to attend. Finally, we will once again, as I said, we will be having networking this afternoon, so we really hope that you will use that opportunity to connect with your colleagues. We're pleased to once again be able to host the Late Early Show. The Late Early Show will provide a recap of the day's events, and we'll give our hosts an opportunity to share their thoughts on how today's lessons can be applied to specific regions. And tomorrow morning's region will be South Asia. And we're pleased to have hosts and guests from around the world, so please tune into that. We are also pleased to have the Sanitation Workers Award for the first time. We will have this at the end of today's plenary, and this was sponsored by the International Labor Organization, SNV, WaterAid, the World Bank Group, and the World Health Organization. So please stay tuned for the end of this plenary to see the presentation of these awards. As you may have already seen, in order to chat and interact with our plenary speakers and to ask questions for today's plenary, we will be using the chat feature on Pathable. I believe many of you have already accessed this, so please continue to do so to ask questions, leave comments, share your thoughts, etc. And just so you know, the Pathable chat will stay live even after the plenary, so folks that weren't able to tune in live will still be able to see what you share. We'd like to say thank you to our sponsors who make this event possible. Specifically, we would like to thank the Bill and Melinda Gates Foundation, the German Cooperation, GIZ, the Washington Schools Network, and the Osprey Foundation for sponsoring this plenary today. And without further ado, I'd like to turn it over to Dr. Erin Salzberg, the director of the Water Institute, to get us started on today's plenary.
Thank you again, Cody. And for those of you who are new to the Water and Health Conference, just to remind everyone, the goal of the conference is to bring together scientists, practitioners, and policymakers from across the world to review the latest science and evidence around WASH. And it isn't really about one group speaking to another, but about all of us learning from each other and bringing forward the best knowledge and experiences from both the laboratory and the field. I'm particularly pleased to say that, like last year, we have over 100 countries represented, and that more than half of our registered participants are from low and middle income countries. I'm really excited by this year's agenda, but before going any further, I do want to say a few thank yous, since I won't be at the mic too often. First, to the Water Institute staff, faculty, and students that support us. In particular, I want to thank Kata Liang. I think all of you know by now, this conference would not happen without her. She is the heart and soul behind the conference, and we're incredibly lucky and grateful to have her. I also want to thank Joe Brown, Clarissa Brocklehurst, whose guidance and work helped make all the plenaries and many of the other events possible. A special thanks goes to Cody San, who you've already seen, Manal Khan, and Alicia Marshall, who, as many of you know, made much of this possible and has been doing a lot of the behind the scenes work. And of course, a huge thanks to Mary Margaret and Elizabeth and the team from Island Innovations who are supporting the technology platform. Last but not least, a big thank you to our sponsors. As Cody said, this conference is only possible because of them. And not just our big sponsors, but to all of you that paid voluntary registration fees, all the other sponsors that contributed. Keeping this conference free is perhaps the most important step that we can take towards making it accessible, and your contributions make it possible and are allowing us for the first time to offer translation services across 5 different languages. It may take time for word to get out, but we do think that ultimately this will be a conference that anybody can attend. As I mentioned, I think we've got an exciting agenda this year. I won't go through it all, but I do want to highlight a couple of events that I hope you'll make some time to attend. Tomorrow's plenary will focus on the evolution of rural water supply. On Wednesday, the plenary, we will hear from several of the scientists that have been involved in the recent Lancet study on the future of WASH. On Thursday, our plenary will continue to build off a topic we started to explore last year, which is inequalities in WASH. This time, we'll be looking at inequalities in high-income countries. And on Friday, we'll have 2 very special guests, Ambassador Chabo Kurosi, who, if rumors hold true, may be the next president of the UN General Assembly, and Her Excellency Yvonne Aki Sawyer, the current mayor of Freetown, Sierra Leone. Madam Mayor was named by the BBC as one of the world's most influential women in 2020. When you see her, you'll know why. Both of our guests are committed to WASH, and they'll both be here to tell us what we can do to raise WASH issues on the political agenda. And for those of you that may not be able to tune in to the entire conference, Cody mentioned, due to time differences, we are hosting again our late early shows, which is a recap of the day at the Water and Health Conference. So please feel free to join us there. So that brings us to today. And as many of you know, we like to open the conference with what I like to call the Mythbusters session. A quiet conversation among friends to explore what we know and don't know around a critical issue that we're struggling with in the WASH sector. And today's plenary is on achieving safely managed sanitation. Many of us are familiar with the work of Joe Brown and others, along with the outcomes of the MAP-SAN trials that showed that the building of toilets alone had little impact on health outcomes of the individuals using them. In fact, what we've since learned is that people, especially in dense urban population settings, are living in a pathogen-rich environment, and that teasing apart the proximal cause of water and sanitation-related diseases is extremely complex. We've also learned from work by some of the folks on our own panel and by Dr. Musa Manga here at the Water Institute that the lack of proper sanitation and wastewater treatment is a potential major source of pathogens in the environment. This has been broadly recognized and is why the indicator we use for measuring progress on SDG 6 calls for safely managed sanitation. But what does safely managed sanitation mean? How do we achieve it? Can we achieve it? How many people are we really talking about? What does the evidence and experiences from the field suggest about how we can build systems that work and are reliable, sustainable, and resilient? Well, we've brought together what I think is an exceptional panel to help us think this through. And for the sake of time, I'm not going to read through their bios. You can see them all on our website. But I'd like to quickly introduce and invite them to turn on their cameras. Barbara Evans, Chair in Public Health Engineering at the University of Leeds. Malini Reddy, Professor in the Center for Environment and Urban Governance and Infrastructure Development at the Staff College in India. Kate Medlicott, Sanitation Team Lead at the World Health Organization. Najib Lakoya, Urban Environment, Water and Sanitation Management Specialist in the Citywide Inclusive Sanitation Initiative's Africa Hub. Juliet Willits, Research Director of the Institute for Sustainable Futures at the University of Technology in Sydney. So let's go. And again, just to remind folks that want to ask questions, please use the chat function in Passable. So thank you everyone for joining us. And let's see, we've got all the cameras on. Is everybody with us? Melanie, James, Najib, are you with us? You can turn your camera and mic on. Good, excellent, great. Okay, maybe what we'll do is we'll start with the first question that I asked, which is, what is safely managed sanitation? What does that actually mean? And what does that mean to you? And maybe we can go around the entire group quickly, but maybe, Barbara, why don't we start with you? From your perspective, what is safely managed sanitation?
Yeah, it's a great question. $1 million question. Yes, exactly. So very briefly, I would say it's a system which does three things. It's a true safely managed sanitation system is going to protect public health. So, basically reduce that pathogen-rich environment you just described. It's going to protect the environment, so minimize particularly the discharge of nutrients and heavy metals and other things into the environment. And it's going to be part of a sustainable urban system. So it needs to be part of, or indeed the means to manage, the black water flows, fecal waste, also household grey water. It's got to interact with stormwater, and it's got to interact with solid waste management. So for me, fundamentally, safely managed sanitation is an integrated system. And I will tend to say things that say it's an urban system, but I think increasingly we have to think about sanitation even in rural environments in that holistic way. So that to me is what a safely managed sanitation outcome would look like, ideally.
Najib, is there anything that you might add to that, given your presence out in the field?
Yeah, thank you, Barbara. I think she summarized it well, and I liked the last part, the holistic. Safely managed sanitation does not just mean also that we focus on the technical part, the infrastructure, but also now there are issues of dignity, privacy, safety, especially for the vulnerable, the most vulnerable groups. We increasingly see that much of the risks we have also have to do with these social aspects around sanitation systems. So yeah, I think it's that I can add quickly. Thank you.
So there's a public health component, there's a protecting the environment component, there's a human component around privacy, dignity, safety, and that we need a systems approach. Others want to add to that, or do you think we've got that definition down at this point? Juliet?
Sure. So yeah, I'd agree with what we've heard so far. And I think we should remember that sanitation is a human right. And so when we think about safely managed sanitation is a human right. The human right isn't just about the toilet, which seems to be something that we might have forgotten, at least over some time. And the other thing I would add is about it being a public service. It's something, if we're going to provide it to all, then it is about a public service, and that might be delivered in all sorts of different ways. There may be private providers, there may be householders involved, as well as public, but fundamentally it should be offered as a public service.
As a public service, does that mean it's for free and we don't charge users for that? Malini, did you want to add to that?
No, I completely endorse Juliet's view. I think safe sanitation is should take a public service approach. That doesn't mean it is free. It means that it takes the rights approach. It focuses on providing access to sanitation for all at affordable prices. One could think in terms of bringing very effective public-private partnership models with user fee included. So at no point does public service approach say it's free, but it means that everybody is included, and there is a focus on public health, a pathogen-free environment, which is not just towards the end of the value chain or end of the town, but throughout the value chain and throughout the town, throughout the settlements that people are residing in.
Great, that's really, oops, sorry. Yeah, that's great, that's really helpful.
Can I add something?
Please, Klaus.
Yeah, I think we should not forget that the basis of sanitation, water and sanitation is the household, no? Okay, it's a public good, you need drainage, you need solid waste, but a healthy household where the family is living, this is maybe the most important, no? And a healthy household, you really need a water connection with good quality, with good quantity. You need a wastewater collection, because as you have water, you're going to produce not only the fecal, but also gray water. And what is mostly forgotten in many cases, the household itself. You know? We require a household where you have the internal installations, you have a shower, you have a sink, you have the toilet, because this is necessary. No? And most of the projects are not looking for the household. No? So I think that water and sanitation, you have the water infrastructure, you have the wastewater infrastructure, but in the center is the household, and the household should be never forgotten. This seems quite obvious, but the fact is that it's quite normal that people don't think about it. No? You do a sewer line, you do the infrastructure, and you simply ignore if the guy is able to connect, if he has the internal installations, if he's able to pay for it. So we must a little bit change our mind and remember that the household is our key issue to be put in good conditions.
No, I appreciate that focus, and also you're being a little bit more explicit. And Barbara mentioned the environment, but you were a little bit more explicit about the need for wastewater treatment and that part of the component of this. And that's really part of an interesting challenge. And I know, Kate, you've kind of been at the forefront of all of this about how do you define safely managed sanitation in a way that we can include. I mean, does it really cover everything from initial containment to wastewater treatment? Is that the way we have to look at safely managed sanitation?
Yeah, for sure. And I think that the safely managed sanitation chain is becoming quite embedded as an idea across the sector now. But as I was thinking of this question, you know, you come onto a panel and you think, oh, I need to say something new and clever. And then I glanced up here and I have a collection of old books, some of them going back to the 50s of Wagner and Lacroix, for those of you who have been around a while. You thumb through those and it's all the same stuff, right? There's nothing really new in here. We're talking about groundwater protection, we're talking about environmental protection, you know, basically preventing human contact with excreta at all steps of the sanitation chain. So there's nothing really new here except what that was really defining it as a global goal and acknowledging that what we have been doing up until now actually hasn't necessarily been doing that consistently. And I think, again, sort of looking through some of those old texts, they're very technology focused. And I think when we talk about safely managed sanitation, we normally say safely managed sanitation services, and that implies all of the things that need to come with a service, you know, the people that manage it, the financing, all of those other things. And if I may extend on our acronym, it's not just SMSS, but another S at the first, which would be sustainable. I think we're thinking a lot more about sustainable safely managed sanitation services and really setting that as a global goal that gets transferred into national targets and policy. So that's to my mind.
Well, you know, you mentioned that there really isn't anything new that we've learned. And so, I want to go back to go back to that in a second. I have the benefit of working with Musa Menga here, who educates me about these issues better than almost anyone. And one of the things that he looks at, of course, is how pathogens enter the environment along the supply chain of safely managed sanitation. And I guess maybe this is a question for the scientists among us. I mean, what have we learned about the pathogenic nature of human waste and its impact on human health and is persistent in the environment? Is this a threat that we really do need to be as concerned about as it seems to be? Is it the linchpin to really preventing a lot of these water and sanitation related diseases that we're seeing?
Can I jump in, Erin?
Please.
I've also just noticed a side, I don't know if my fellow speakers saw it, but there's a request from the translators that we all speak more slowly. And as I know I'm the worst culprit, I'm going to try and model speaking more slowly. So yes, human fecal contamination is a problem. I think one of the things we have to be very aware of is that disease transmission can happen through a range of pathways. I think in different contexts, people do sometimes get a bit fixated on single pathways. One of the things that interests me is that people very often have, people who aren't perhaps specialists in the area, are quite often very aware that there might be a risk of contamination of groundwater from pit latrines, for example. But I think people tend to be less aware that there are equally hazardous flows in surface drains. Well, surface drains for me are one of the big neglected, serious hazards because the risk of exposure is extremely high. I think the slightly longer transmission pathway via the food chain is very often missed or not understood, and particularly for bacterial infections. And if you want to scare the bejesus out of your policy colleagues, cholera, that's one of the really important pathways. And we know that there's a lot of fecal-oral disease pathogens which do very well in food chain environments and multiply and become a real hazard. I think the very unfashionable issue of geohelminthic infections and ascaris, which infect probably about a third of the global population. We've got to get all of that fecal matter away from our water supply, but crucially away from the food chain if we're going to break those cycles of transmission. So I think we know a lot. I think one of the things that tends to happen, it's like the old legend of the camel. If you look through a hole in the wall, one person describes the legs and one person describes the head. I'm not sure if that's the right legend actually, but I think one of the problems is that sanitation is big and complex, and there's no getting away from that. And it's also quite expensive. So, I do think it's really important that we get it right. And I think that science that you're mentioning, Erin, is really important. Just one final thing, as just thinking through some of these transmission pathways which get neglected. Another thing which is often, I think, misunderstood is that so-called highly developed sanitation systems, so I live in the UK, for example, our systems are designed to discharge waste into the environment pretty much whenever it rains. And it's really important to be aware of that. And there may be circumstances under which that's acceptable. It depends really on what's happening downstream and what the risks are. So I don't know if I've said anything very clear, but I think the thing to hold on to is that the web of hazard creation and transmission pathway and exposure that's associated with sanitation is very complex. And it's really quite important, I think, to listen to technical specialists as well as others, when we're really trying to understand how to minimize those risks. It's sometimes, I think, a lot more complex than it's presented as.
Well, and not just complex, but as you highlighted, a dynamic system that's changing. And as we experience more and more hydrologic variability and extreme climatic events, that too might then exacerbate some of these challenges in ways that we haven't quite thought of. So we've got kind of this picture now then of what safely managed sanitation is, and that it's the source through treatment, it's protecting human health, protecting the environment, it's got a strong social component. We need to take these systems approaches. This seems like a really high bar to try to meet. And we've got this SDG goal that's out there that we're all trying to work towards. And as Juliet points out, there's some recognition of this idea of a human right to sanitation. Why aren't we making progress that we'd like to see? Why is it so difficult to do safely managed sanitation? What are the real challenges that we face in trying to achieve some of this on the ground? Najib? Sorry to put you on the spot. You're muted.
Thank you, Aaron. It's indeed a very complex piece of the puzzle. I was just looking at some quick statistics here by World Health Organization and UNICEF. And when you look at the statistics, you see that we've made some progress between 2000 and 2017 in their report on the status of global sanitation. I see that in 2000, for example, 1.7 billion people, or 28%, had achieved safely managed sanitation, compared to 3.4 billion, which is 45% in 2017. So that seems to point to the fact that, yes, we've made some progress. The challenge is not leaving anyone behind. That, for me, that is the greatest challenge. Because you have complex approaches in different regions, different economies, different social contexts, different economic challenges, different priorities. Countries are trying to chase different parts of the SDGs. And my biggest question has always been whether, I mean, every goal is a priority according to their own champions. The healthy guys will say, yeah, we need to achieve good health. And SDG 6 guys are saying, yeah, we need to push and push further. What is striking with some of these figures is, and I'll try to link health in goal 3 and sanitation in goal 6, target 6.2. There is a clear mismatch and coordination between those two. You will realize that many healthy facilities, for example, do not have access to safely managed sanitation. And this is where people should be accessing medical health services. And this is very strange. In schools, most schools do not have safely managed sanitation. So for me, this is the worrying bit of it. In urban communities, the poor communities, the informal settlements, are living in a cycle of feces or shit, as the show is. So we seem to make progress, and these numbers seem to come from certain parts of the world, certain parts of the globe, but in certain parts of the world, we seem not to take or make radical shifts to make safely managed sanitation a priority. My last contribution on this will be that, yes, whereas the global figures reflect some progress, we, I think, have blurred evidence from the ground. So as you leave the household to the country, to the global level, there is lack of adequate evidence to inform our practical planning and investment. So there seems to be a need for more effort. First of all, besides other enabling environments and financing needs, to focus a lot on generating evidence on what's happening. And that probably will be an accelerator to informing some of these radical shifts that we need to make the progress.
There we go. Kate, Najib raised this, Klaus also raised this. Klaus pointed out the fact that if you don't have water on premise, then moving to sanitation services is probably a bridge too far, and that you need to be able to provide these things collectively and together. Kate, from your perspective, Najib just mentioned the scope of the problem. What do you see as the scope of the problem? Do we have reliable numbers to help us understand who has access, who doesn't have access, and how are you collecting and thinking about that data and identifying those different populations?
Yeah, so the people at WHO who do that are the JMP team and the GLASS team that look at the financing, the rates of progress. And, we started off kind of painting a rather bleak picture, but the most recent JMP reports do show rates of progress, and in some places they're quite encouraging. But it's also been really stark to see that we need to quadruple those rates of progress to reach safely managed sanitation. So that is a really heavy lift. And I guess, yeah, I think I always find it a bit depressing actually when I look at the WASH accounts data and the investment in sanitation, and investment is a proportion of overall health expenditure or compared to water expenditure. It's really tiny. And so we do need to kind of massively increase those investments in sanitation. I think partly we've done ourselves a bit of a disservice as a sector by kind of painting sanitation as a household responsibility that households need to do for themselves and invest in for themselves. And I really think, and we tried to get this across in the State of Sanitation report, that it has to be a public good that needs public investment, because the benefits of sanitation don't just accrue to the household who invests in their own toilet, but they accrue to all of society. And what's more, me as a householder, I have very little control over what happens when it comes to conveyance and treatment and reuse. So that has to be taken up as a public service, one that costs money and one that essentially governments are responsible for. So I think we need to really strongly push this message that sanitation is a public good and that needs public financing, and we have to build the political will for that. And I think we're actually seeing that to a certain extent through things like the Citywide Inclusive Sanitation Initiative, where we're seeing more utilities and regulators take on that mandate. So I think there's some green shoots that are quite exciting, and we shouldn't feel entirely despondent about this. So just one other thing to add, thinking of Barbara's point about the camel, and this is something that makes me feel a little bit more optimistic as well. I feel like when I entered the sector, you had your fecal sludge people and you had your CLTS people, and we were all, as Barbara described, like looking at parts of the camel. But I think we are, all of us, becoming specialists in our own area, but more generalists in understanding both on-site and off-site and what needs to happen at all steps of the sanitation chain.
Malini, Kate mentioned the governance challenge and that the lack of financing for the sector, and we really need to build some of that. But she also mentioned the need for evidence. I'd love for you to be able to reflect on both those questions. What's the evidence that you think would help compel policymakers to action, and what are the governance areas that you think need to be strengthened? And Juliet, I'll come to you afterwards to ask that same question, because I think it's really interesting.
Thank you. I'll get there, but I think as an Indian, it's my right to correct that camel. I think it's the elephant and the 6 blind men. So Coming to some of the points that Kate raised, and definitely I think political advocacy at the local level is something that is something of a struggle. So while there is immense amount of ownership at the senior echelons, ownership when it comes to the local level, because that's where the implementation really kicks in, is not as strong. The other aspect that we really struggle with is in terms of capacity building of people who are involved in construction of toilets, and behavior change among citizens to even as simple as constructing right-sized containment, leave alone the proper technological aspects of the containment. Financing, of course, is a challenge, particularly to Claude's point of ensuring access at an individual household level, and how do you at least bridge the gap so that the access gap can be covered. But my concern really is about the challenge related to technology innovations. Where are the innovations in sanitation, and why is sanitation sector so slow on that? I mean, in a country, in urban spaces in India, for example, it is impossible for households, particularly coming in lower income settlements, to have a soak pit after a septic tank. It's impossible. There is no space, there is no finance for it. So do we consider them as unsafe sanitation and let it be? Where are the technology innovations where you can get prefabricated, good quality containment systems which can just be fitted without having really well-trained masons? So why aren't we thinking on those lines? Why aren't we investing and really scaling up the commercialize the models of in situ treatment? I mean, in today's time, or any time for that matter, having a human being remove the fecal matter, no matter how mechanized the process may be, just cannot be acceptable. So why are we not looking at treatment systems in situ where the toilets are? I think the innovations in the technology innovations in sanitation are really slow to come, and they're not meeting the requirements. We were discussing this earlier also around that in the recent years, India has really taken huge strides in making individual household toilets available. There is a huge debate going on that since the containment systems are so bad, yet the pathogen levels in the environment have not really come because they're flowing into the open drains, to Barbara's point. I agree. But then to Najib's point, this is also a balance between privacy and human rights and dignity of having your own personal space versus waiting for the perfect containment system to arrive for individuals to have that privacy and right to dignity and toilets in the personal space. So there is this huge debate, yes, but then there are no technological solutions to retrofit, say, a toilet which is already constructed, while the superstructure is fine, but the substructure isn't. So what are the retrofitting models which are available and can be scaled up and are affordable?
That's something we're certainly going to take towards the end of this, which is, what are the technologies that we need to focus on? Juliet, did you want to talk a little bit about some of the evidence that we actually need to maybe catalyze change? And then Barbara and Klaus.
Sure, Aaron. So firstly, maybe just to build off Malini's discussion of containment systems that don't contain, I think, and also to go back to Kate, what you said of that we've known what most of the solutions are for a long time. But I guess the point I'd like to make is the moment we're drawing our diagrams, and apart from the ship flow diagram, which does take into account, but we don't acknowledge the liquid stream that comes out from on-site systems. and we draw the diagram as though there's just the sludge that gets collected and everything's cleaned up and done. And I think the problems that Malini's pointing to mean that we need to take much more care and thought of what are we going to do with that liquid, and in which situations is it, as Barbara described, that it's fine for it to percolate through the soil. In the soil, the pathogens will be deactivated, and they probably won't reach groundwater, or in other circumstances, maybe they will, and maybe people are using that shallow groundwater for drinking water. So we need to think in which context to which things matter. And it's not just a simple, this technology will fix, everywhere, but it's in which situation will different technologies work. But certainly, no matter what, we need to pay better attention to the liquid stream. The one other thing I wanted to mention to your earlier question, Aaron, about institutions and governance, and there was a comment in the chat from Mr. Mwanza, which I totally agree with, which is just that sanitation sector just suffers from being so disaggregated across different agencies. And only in a few places do we have, like Lusaka, etc., where we have a utility that's responsible for sanitation as well as water, and actually looks after on-site sanitation. But in most countries, it's so unclear really who's responsible. And I think until we fix that institutional level challenge, it's very hard for us to solve any of the technical challenges.
That's a really good point. Barbara, I know you had your finger up for a quick...
I'm actually going to cede to Klaus, because I'm going to lay some money that he's maybe about to say what I would have said. Let's see.
Okay, Klaus, it's all yours.
Yeah, when Kate talked about that, we don't need really very many new things. This is something that we realized in practice, because when we decided to implement sewerage to all the city, we wanted to try some new technologies especially in low-income areas, no? But the people just started to ask ourselves, why do you give something different for the rich? No? We want the same. And so it came to a point that we had no options, because Brazil is a democracy. What the people say is very important. If you don't hear them, you start having problems with politicians, with the media, with the society. So at the end, we realized that what we need is to try to have the people happy. Our customer must be happy, and they want the traditional. They want a water connection, they want a sewer line, and that's it. And anything less than that, they are not happy. So what we did was try to develop sewerage solutions which are affordable. So we started to reduce diameters as far as we can go. We are doing shallower pipes, we are doing smaller inspection boxes, so that the system gets affordable. And this is what we did. We even tried at a certain time to use on-site sanitation, but the results were very bad. The on-site sanitation depends on so many things: the amount of water, the amount of space that you have, the kind of soil that you have, the topography, the rainy season, and we just abandoned it, at least for a urban solution. So we realized that we need sewerage and let's say a low-cost sewage. But still, we had this problem with the low-income community. Society doesn't accept that we give them something different that we give to the rich ones. So what we did is that this low-cost solution that we were trying to apply at low communities, we extended it to the whole city. So even in the rich areas, we are applying this low-cost technology for the sewers and for the treatment plant. And then we have peace at the city. Everyone is okay. And one important thing that we learned is that people want to pay for the services. So when I think this discussion, public goods, we need to finance. Look, if you have a professionally managed service, it is sustainable for the financial point of view. And I think Brasilia is a good example, because we have full service for water and sanitation. We treat all of wastewater, and we are a utility which lives from its own income. And I can say we are a very rich utility. The salaries that are being paid at CAESB are well above the average from the market. So, and we still have a lot of low income areas, no? So when you talk that sanitation costs too much, it costs too much when it's badly managed. No? We as a utility, we want the people to connect, not only because we want to give them health, a good household, but also because a connection means a bill at the end of the month. No? So if I put a sewer and the guy doesn't connect, I cannot bill him. So what we had to do, we had to go inside the household because we want to have the customers. No? And scale plays a lot. If you have large areas and large systems, your costs go down. No? So the whole thing gets more feasible. So I think that the sanitation sector is much more a problem of managing. We need professional management instead of technology, because technological solutions are there. You can do lower cost solutions, but if the utility doesn't have a good tariff, if it doesn't have meters at every household, if they don't read the meters, if they don't have a commercial area in which if someone doesn't pay, he is not going, nothing happens to him. This is not going to be sustainable. No? So we have to look more, I think, on the management. No? I was mentioning last meeting, we kind of need like a utility management discipline so that the directors, the board of directors go there and learn what they have to have as a strategy for the utility in the midterm. We must look for tariffs, we must look for metering, we must look for water loss. And this is all known, no? But it's not, I've been to many utilities throughout the world where I ask how many coverages for metering, about 30%. Well, it's impossible to survive if you have only 30% of meter. No? And if someone doesn't pay, well, so it's like a bank which is not caring of his money. No? A utility which is not looking.
I mean, I agree with you, and I hear what you're saying, but Najib, I'm going to turn to you, and I'm going to turn back to Malini in a second too, because if I'm the two of them listening to this, I'm also thinking, look, I've got some contextual environments in which that's just not going to work. I'm just not going to be able to provide that. Now, Barbara disagrees with me. Okay, that's good. But maybe Najib, I mean, do you agree? I mean, look, I share costs, and I completely agree. That's where we want to go, right? We want to be able to offer that package of services, and we want to be able to connect them up to the system and make that work. I am concerned, and maybe I've got this wrong, that Najib, Malini, Barbara, you guys are working in areas where it just can't be done for some of these populations. Am I wrong? Or should we still be pushing those types of, can we get there? Or is there something else going on? Najib?
Very, very good question. I think Klaus, I benchmarked in Brasilia, KSB, I think. We wanted to do some work for condominium systems in Kampala at that time. And I assure you up to now, sorry to disappoint, it has not worked for some reasons. It has not yet worked. It was a very good system. So the issue of context is important. Even within a space of 1 kilometer, you will find solutions that work in point A and point B 1 kilometer away could not work, and for various reasons. So, and these reasons I think have already been documented. Social issues, economic factors, affordability, acceptability, culture, and so many, you can really name them. The other aspect is we are talking about on-site and seaward sanitation. So for countries, especially in sub-Saharan Africa, the water supply element, availability of water is crucial for waterborne systems. So you will notice that most of the times it's probably you design waterborne systems very nicely. The technical aspects are taken care of, but to make that system work, you need other things beyond the technology that you've deployed. So for me, I think you're right, Aaron. Things definitely work differently in all spaces, and local tailored solutions, in my case, work best. We tried, for example, to promote biogas toilet systems in schools. And our reason was we could have a synergy of both energy supply, low water use, and also decent sanitation for the children. And I tell you, it took us about 2 years to convince the schools that you can use biogas toilet. I mean, biogas from toilets for cooking food, which children can take. And so cultural barriers are quite significant in some cases. So I can go on and on and on, but so the context matters. For me, what is important is, one, we all know that we are human beings, and I think we forget this basic principle, biological principle. You have human beings, every human being will produce human excreta. And that hot moment when you need to go to the toilet cannot be stopped. So someone will need to go somewhere. Now, there is the element of the hotspot. So you have the hot moment when you need to go to the toilet, and the hotspot, where do you go? So this is the conversation that you take to the people, to the household, to the leaders, to the financials. Eventually, you come up with human-centered design. So these are some of I have seen many projects that are ongoing, financed by various multilateral banks and donors and NGOs that are starting to design systems that are demand-driven. So starting from the household and working backwards to give them what works. Thank you.
Great, thank you. Barbara, a quick response, because I know you wanted to counter what I had suggested briefly. And then Melanie.
Yeah, I'm just trying to fit into the flow of the conversation. So this question of local appropriateness, I think, is very important. And I think it's to do with what locally what individuals and households need. But I think in that sense, I don't think Klaus is saying anything different from Najib. What households generally want is reliable water supply, and they want the crap to be taken away. Most people honestly don't care what the system is. There are cultural, social things we have to be mindful of. Malini mentioned particular issues, but I think, you know, most people, if you offer them a service that's reliable water supply and reliable wastewater removal, that's what people want, and they're willing to pay for it. I think the reason why I twitched earlier is because I do find I get quite anxious with this idea that we can't proceed without technological innovation. I'm sure that technical innovations will always give us greater efficiency. There may be toilets we haven't thought of, whatever, but I would flip that over and say, with the technology we have today, we could solve this problem, and not at a massive out of order expense compared with what generally governments spend on other public services such as transport networks, airports, whatever it might be, the army, the education system. So I just wanted to really counter that and lean in on this other point, which is that it's mostly, in my opinion, about the capacity of organizations to manage. I wanted to pick up one point on this, sorry, Aaron, and then I will stop. In the chat, there was a sort of little discussion going on. I'm going to pick the comment from Paul Hutchings that sort of says, does this mean that everyone has to know everything about everything? No, in Klaus's context, there are people in KSB who are absolutely world specialists in some, you know, esoteric element of this, whatever, wastewater treatment system or making the pumps work or whatever. Of course, we need specialists, but what we need are management systems which can look at the whole system. You know, you can look at how we're going to co-manage the water supply and the sanitation system. So yeah, I just wanted to try and really counter this idea that we don't have the tech to solve this problem. I really genuinely think we do if we want to.
I mean, I hear you, Barbara, but I'm not convinced. I still think there are some environments in which, you know, without human labor going in and manually emptying some of these systems and manually carrying things out, getting the equipment we need to the site to be able to properly manage those systems, I still struggle with that. So I'm going to turn to Malini first. I'll come back to you, Barbara, because I'll let people argue with me on that one. But Malini, go ahead. Malini, if you tell me I'm wrong, I will back off.
No, absolutely not, Aaron, and I need you to back me up on this. I agree, it is contextual, and perhaps Barbara's context, you know, the need patients might not be very strong, but in the context that I am working in, I think is absolutely essential. Some of the Brazilian models have been tested in India and have not worked well. It could be because of understanding of how to implement them, but really they were meant to be low-cost solutions for low-income communities, but it ended up being really high-cost solutions for low-income communities. It didn't work. In a context where less than 30% of your towns don't have sewer systems, where you are water-starved, sewer is not really a solution. Non-sewer sanitation is what one has to look at. Even a small bore requires a tremendous amount of water to make things moving. So definitely professional utility management is required, no doubt about it, but it takes time and takes a hell of a understanding to be able to get there. It also requires a lot of citizen maturity to be able to see it in addition to regulations. However, at this point, I would say that to Claude's point, when we speak about sanitation as a public service, it doesn't mean that citizens are not required to pay for the services. They pay, and perhaps you could have pro-poor pricing and tariff structures. But what worked for us, and what I would like the panelists as well as members attending this to think about, is that how can we leverage on private sector intelligence, private sector management models to support the governments in countries like India, in developing countries like India, to help in moving towards professionalizing and to help towards moving a professional utility management structure. And I think we are in that phase right now where we need technology solutions which will reduce human interface with fecal matter, and the existing technologies really need to be ramped up.
Barbara, 2 seconds, because I know you were, sorry, I antagonized you again.
No, sorry. I just want to clarify. I'm not saying sewers are better than on-site. I'm saying that the key is to get the service that people want at the household level. I also, sorry, I don't want to go into super technical things, but I want to also challenge the idea. So what are we saying? That there are places where we think it's okay that people have not enough water to run a small bore sewer. That means basically not 20 litres per capita per day. So, you know, we really have to ask the question, first of all, what kind of water service do we think we should be providing to people in the world in the 21st century? And there's, you know, there's steps to get to these places, but I don't think we should be, I don't accept that we have to say, oh, this place, these people don't have enough water to drink, and therefore we can't give them a decent sanitation system. I think that's the wrong way round of asking the question. Wanted to just pick up on also the point that we can see here very strongly the link to housing policy. And, you know, if people are living in housing which is so dense that you can't get any kind of emptying system or a small bore sewer into that housing area, then I'm sorry, that's a failure of housing policy. And we can't expect the sanitation sector. It's almost like we expect the sanitation sector to solve the water supply sector's problems and the housing sector's problem. You know what I mean? It's like these things are connected together, and I think it's critical that we don't accept some of these contexts as unchangeable.
No, I think, Barbara, that's exactly where, I was hoping to go, which is thinking a little bit about the fact that, look, it isn't then just about putting these sanitation systems. We have to rethink some of these living environments, and we have to rethink some of the organizing principles around that. And governments need to not just focus on then sanitation, but on the broader set of housing policies and urban planning systems that are going on that might enable us to provide environments where we can provide those complete services. And so I do wonder, as we think, Juliet was talking a little bit about the budgeting of these systems, where do we put our money to accomplish these goals and objectives? Where is it? Is it on the technology? Is it on the policies for urban planning? Is it on the water supply systems? I mean, what is the right way for us to invest to begin to make a meaningful difference in providing services if just investing in these basic services isn't the right way? Juliet, I don't know if you had a thought on that. I don't mean to pick on you necessarily, but it was either you or Kate.
Kate, you can pick it up after I've had a go. So your question is where should we invest? Can I just clarify?
Where would we make a difference?
Where would we make a difference? I think we make a difference. I think we make a difference in any of those entry points. I don't know that there's one particular entry point in every context that will be the best starting point. I think in a place that is reviewing its approaches to spatial planning or whatever, that's an entry point to work out and solve some of the sanitation issues. In a place that's shifting the institutional environment and utilities are taking up more responsibility, and that might include sanitation, there's another entry point. So I don't think there's one particular entry point that we should fixate ourselves on. I think sanitation is cross-cutting, and we need to be opportunistic, if you like, in picking up any opportunity we can. Over to you, Kate.
Well, before moving over to Kate, but Juliet, maybe a quick question. Do we know what we need to know, or are there still outstanding science questions that we need to answer that would compel political leaders to action? Is there something unanswered out there that we need to better understand?
At the very micro technical level, yes. There are things like we don't know how pathogens split up into sludge and into the liquid, and really how long they end up surviving in different environments, and which type of pathogens. If it's a virus, will it go further? If it's a protozoa, because it's heavier, will it something else happen? There's lots of the science that's not explored. So, large-scale wastewater treatment has been studied for 100 years, and on-site is a much more recent history of scientific investigation. But even those questions still exist. I would agree with Barbara that it doesn't mean that we need to stop and wait till all that science is figured out. There's some basic science that we know enough of what we need to do to put barriers between humans and the pathogens and to deactivate them in different ways, that we can get working on that at the same time as improving the science, which might refine and improve the way we deal with it, but won't fundamentally change a lot of the basics.
And Kate, maybe to put you, thank you, that's helpful. Kate, maybe to put you a little bit more on the spot, because you're also kind of in a unique position. We've covered a lot of ground. This is incredibly challenging. How do you actually measure success? And from an SDG perspective, we talk about what safely managed is, and I know you guys are working on trying to define that in a better way. But what is success when it comes to safely managed sanitation?
Yeah, well, if you don't mind, I'm just going to go back.
No, I've thrown a lot of your way.
Points as well, because at the risk of leaving you thinking I'm a kind of a Luddite who thinks there's nothing new and no innovation happen, that's not what I meant at all at the beginning. What I meant to say is what we need our sanitation systems to do for us is not new. The kind of performance we need is not new, but how we get there is really where the questions are, how we get there in terms of all of these different service delivery models, of which technology is a part. And I feel like in that conversation before, we were starting to kind of get into some old sort of ideas like technology transfer or something. And actually, we just can't get away from the fact that these are quite context-specific things, and we need to be working from some form of local level risk assessment, which takes into account the economic environment, the physical environment, as well as the sociocultural things. And unfortunately, we'd all love to have a great shortcut for that, but there isn't one. In terms of getting to your question about kind of what we should measure, I mean, of course, we've got these wonderful safely managed sanitation goals. That needs to be our North Star in terms of what we measure. And there's an awful lot of data gaps to be filled there still, especially related to on-site sanitation, data around emptying, transport, fecal sludge treatment. There's really big gaps there getting nationally representative data, and even bigger gaps in terms of getting to disaggregated data that's really helpful as a kind of a day-to-day management tool. And I think we really need that, especially the disaggregation eventually, because I don't think we can claim that we've been successful if we've really left big chunks of the population behind. I quite like this new global acceleration framework and the 5 domains that are within that as a way of kind of thinking about what we need to do and how we might measure it. So for me, on the first domain, which is governance, I think measuring like how many utilities and regulators are accepting this mandate, sorting out those mandates, and that would be a really good thing to try and measure more. On finance, the second domain, I think really looking at how much more public finance is going into sanitation. Not saying that finance can't come from other places, of course it can, but that to me is the measure of political will. I talked about the data one. The fourth one is capacity. When it comes to the workforce needs to deliver on safely managed sanitation services, maybe the data's out there, but I haven't seen it. How many workers have we got? How many do we need? What kind of skills do they need? I think we've got a long way to go in terms of understanding and measuring the workforce needs. And on the fifth dimension, which is innovation, I think we need to be looking at how are we future-proofing the sector for the things that are going to be real challenges, particularly things like climate resilience, and maybe sorry, just one final thing as well, because I sit on WHO's guidelines review committee that's always looking for sort of gold standard evidence, and we've all sort of been through the mill of these sort of randomized controlled trials, what they can and can't tell us about how to deliver programs better. So I think we need to be thinking about measuring risk reduction better and designing evaluation programs that look at that kind of risk reduction. Not saying that the trials don't have their place, but they don't tell us as much as we need to know in terms of defining transformational wash systems. I'll stop there.
Yeah, Kate, and maybe just, sorry to pick on you for 1 second more about the SDGs and the accelerator framework. I am very concerned that for some of these communities, being able to go from where we are today to safely managed services is a huge step, right? And we all agree that there's kind of a ladder and we want to do this. Are we taking steps to look at the progressive realization and to really reward those governments and communities that are taking progressive steps to improving these services? Or are we just continuing to identify them as, because I do worry as we go into 2023 that we're going to be lumping everybody into this, oh, you're failing category because you're not providing safely managed services to everybody, rather than recognizing the growth that's actually happening to improve service delivery for many, many people and improve the services that are out there. Can you reflect on that for a second, or do I have got that wrong?
Oh, well, certainly what we would, of course, look to, progressive realization, and the way WHO would look at it would be about attacking the biggest risks first. And that's kind of what a SFD framework does for you, to help you figure out what your biggest risks are and where to concentrate your efforts. So that's something about incremental improvement. But I think we should also remember that a safely managed sanitation system doesn't have to be something really complicated where you're, getting the shit out of the ground and taking it somewhere else. especially in rural areas, the systems that we already have can very perfectly be safely managed systems. So we don't have to kind of inch our way up the ladder necessarily. In some instances, you could go from an open defecation environment to a safely managed on-site sanitation solution in one intervention. So I think this kind of going from open defecation to unimproved, is actually has a risk of providing services that people don't like, maybe bring greater risks, sort of fixed point open defecation, if you like, and also providing a service that is actually can't be upgraded to a safely managed sanitation service eventually. So we need to make sure that if we're not getting to a safely managed sanitation service, what we are doing can be built upon by the next kind of intervention. Yeah, I'll stop there.
Yeah, no, I think that's an incredibly important point. This one that we talked a little bit last year about kind of reinforcing systemic inequalities by providing different kinds of solutions. And as Klaus says, look, everybody wants, right? And everybody wants and aspires to a certain level of service. And if you can't create that model for them from the beginning, you may be maybe very challenged in being able to find a way to make that work, especially financially. So I think those are really excellent points. Sorry, Barbara, nope, you're good. So how we look at progressive realization, providing those levels of services, I think that's important. It sounds like there's a lot of evidence that we still need to begin to collect to be able to understand. And I appreciate the point that Juliet, you made, the idea of looking at the science at the local level. We need to understand the conditions on the ground in a real way before we can begin to prescribe what the right kinds of thoughts and solutions are. Sorry, I'm looking at Malini. Did you want to add to that?
No, I had some other points, in terms of how do we go from here. I think one of the critical aspects, at least from the context that I come from, is that do citizens really understand what is safe sanitation in a comprehensive manner? Because typically what we are seeing is that the national programs are focused on a mission mode on achieving one objective, which could be focused on one part of the sanitation value chain. It could be either owning a household toilet, or it could be on sanitation worker program. So all the communication campaigns would center around one particular aspect. Perhaps the citizens are not really getting a comprehensive understanding of what safe sanitation is and where are the points where they're exposed to danger and health risks. So I think it's very important to look at communication in a very systematic and comprehensive manner than what is being done, at least in a context that I'm referring to. The other aspect is making finance accessible to citizens as the next step once you understand. And individual household toilets is a priority, but how do you make finance accessible to citizens in order to be able to achieve that objective for themselves with or without public funding? Innovations that minimize human contact with fecal matter in any part of the value chain is absolutely essential, and predictable public financing towards maintenance and sustaining the systems which are being implemented, including building the capacities of the people who constitute the utility. I think these are some things which I feel are extremely important going forward.
Thank you, Malini. That's great. Okay, so I'm going to go around and I'm going to ask each of you to do two things maybe. One, what's one thing that you've learned about sanitation that you think everybody should know? The one thing throughout your career that you've stumbled across that if you had the opportunity for all of us to understand, that you could tell us. And then two, we are heading into a discussion on policy after this session at 10:45. There's going to be a panel discussion around policies. what are the things that you think they should be thinking about in the development of policies that are important to advancing full services? And maybe I'd like to try to, let's start with Klaus. And then, so maybe we'll go with Klaus, Juliet, Najib, Barbara, Malini, and then Kate. So Klaus?
Okay, well, just two short comments. No? I'm not afraid to say that sewer solutions are much better than on-site solutions, especially on dense urban areas. And the other thing is that you might have the best technology, but if you don't operate it, if you don't maintain it, it's going to fail. No? And what we see is that mostly the infrastructure is abandoned after it's constructed. Well, anyway, regarding what I learned that water and sanitation is sustainable from the financial economic point of view once you have a professional management. No? And a suggestion as a policy, which is a consequence on that, is that investment in infrastructure should be followed or accompanied by investment in institutional development. What we are used to see large infrastructure projects, and institutional development is only a side small package. But in my point of view, it should be the best. It should be the largest, no? Because if the utility is not managing professionally its systems, it will not manage the new infrastructure that it is financing. So it's not going to work. So we have to give more attention for the institutional capacity to manage the systems that we are financing.
Oh, great points. Juliet.
Thanks. So mine, what have I learned about sanitation? I want to have everyone in the sector, when they talk about a septic tank, for them to mean something that has two tanks and it has a soak pit with infiltration, and that is a septic tank. And we've been debating on whether to use the term when it is just the tank and there isn't a soak pit. We don't want to have that debate anymore. Septic tank includes all those components, and the pathogen removal mostly is happening in that last stage, and we're missing that last stage in lots of places where septic tanks are being used. So that's what I've learned, and I want everyone else to learn. And on policy, I would like the panel, I'll be fast asleep. It's really, really late here. So I won't be listening, but I'd really like them to discuss climate change. It's the issue of our time. It has a huge impact on sanitation, and we've been very, very slow to pick it up and think it through. And so I'd like them to address that in the panel. Thanks.
So we need a UN General Assembly resolution on what is a septic tank. Yeah. No, I think it's true. It's one of the things that I've learned here, right? That we even if we have one, is it operated the right way and everything else, even if it's built the right way, right? We still have huge problems around that. So it's a great point. Najib, what's the one thing, well, and I'll even give you two if you have it, that you think that you've learned that you'd like us all to understand, and what are the recommendations that you might have for some of the policymakers?
Thank you, Aaron. Most critically for me is working with evidence. Working with evidence does not mean just data, but also understanding the context in which you are working, socio-economic, technical, and similar, and translating this evidence into working models, so solutions that work for people, demonstrating that these models are available. And like Julie said, if it's a septic tank model that works, are we able to demonstrate this, that it works? And this is where you are able to trigger government support. So advocacy, of the political will and governance. So start with the evidence, make sure you have enough evidence, translate into solutions and models that work, and use this for advocacy to create political will and policy momentum, and then you can scale. So for me, these 3 stages, not necessarily in that sequence, have been really critical. Thank you.
Najib, I couldn't agree with you more. I think that's a great articulation of the process. I know we try to work through here at the Water Institute around, identifying the problem, developing solutions, demonstrating that they can work in those contexts, and then advocating for policy reform. Barbara.
Okay. So one thing I've learned is that sanitation, safely managed sanitation, isn't expensive. It's only expensive if you don't want to spend money on it. I don't think any country that achieves something close to universal access to something like safely managed sanitation, they're all spending between $100 and $200 per capita per year to maintain that service. It's an operational investment. Sounds like a lot of money. It's about 2 orders of magnitude less than we spend globally on chocolate. I think we all need to get over ourselves and spend this money. And we need to think about it. So segueing to your what's my policy message, please can we stop thinking about sanitation as a construction infrastructure sector and think of it as an operational service. So that's the message. We should have no more investment projects without a clear, absolute assessment, like we do environmental impact assessments of the operational viability of the system and where's the money coming from. And if we could stop doing that, we'd save a huge amount of money on tech that just doesn't work. And I'm completely technology agnostic in that space. I don't mind what tech we use to do that, but the money, it's pretty much the same, whatever kind of tech you use.
Oh, I love that idea, and doing the environmental impact assessments and sort of thinking that through. But when you start talking about chocolate and giving that up in order, no, then we're going to. You
only have to give up 1/100th of it. It's not so bad.
It is. Well, speak for yourself. Malini, what's the one thing that you'd like us to take away from this, and what are the policy recommendations that you might have?
Well, before I get there, I'll have to disagree with Barbara on the technical investments part. We do require those with less than even 20% of our 7,000 towns having treatment infrastructure. We can't shy away from it. We do require investments going in, and absolutely agree with her on the environmental assessment. And evidence-based advocacy is what would really get public funding flowing, for which I think grant funding, private sector, corporate social responsibility, philanthropy, that can play a catalytic role in bringing those initial innovations where evidence can be developed from. I agree with all the other points made by the members, but one point which has not come up as yet, and I've seen that it is working brilliantly in India, is bringing women into sanitation decision-making. And we are seeing this across levels, from women in the neighborhood levels to women in the senior most positions in the bureaucracy. We are finding that having women in decision-making positions for sanitation-related initiatives and discussions has a tremendous, they are extremely resourceful, and this includes bringing finance into and enhancing access. And my last point is more of from a marketing point of view, that somehow we need to find ways of making sanitation a non-issue for the citizen, because they really don't care, and they want good service, but they really don't want to think about it. So how do we bring all our resources and knowledge together to make sanitation a non-issue for the citizens is what I would like to leave the audience with as a thought.
Thank you, Malini. In Barbara's defense, I don't think, and correct me if I'm wrong, but she did raise this, you're not anti-technology, and investments in technology, I think, still matter coming, right?
Yeah, exactly. We have to make all of those investments, Malini. I couldn't agree more. And I'm just aware of a sort of, I'm going to just jump back in and say a slightly frustrated comment from Lewis in the chat, that, you know, this is the same conversation we've been having for a long time. And I do agree with you, Lewis. I really genuinely do think that there's there's lots of innovation we can do to make things better. My point is just that we could fix it with the technology we have. So we've got to keep pushing on these institutional financial capacity points. If we can bring in this like better tech as we do it, I think that would be fantastic. But I just don't want the better tech to take our minds off these operational budgeting and capacity questions, which seem very central to me. And it's boring. And yes, we have been talking about it. I mean, I've been working in the sector for 35 years and we're still talking about it. It's really frustrating, but that's the fact.
Well, Kate, you started that, you made that comment as well when you looked up at your bookshelf. But I think we have talked about a few things that I haven't always heard in all these conversations. But Kate, what do you see as something that we need to know that we don't know yet, or that we as the broader community should know? And what do you think are the takeaways for the policy discussion coming up?
I think a personal learning for me is I don't think we just can't take for granted that sanitation makes a difference for health. I have been guilty many times in my career of writing proposals that quote the number of people who have cholera or worms, and then the number of people who don't have sanitation, and then jump to intervention off the shelf. We have to, if you look at all of the evidence out there, we're seeing we're not getting our health bang for our buck out of these investments. And so we have to be much more purposefully design interventions to interrupt transmission, deal with that sort of complexity of the context specificity of doing that. And just to add to it, I mean, that's why we have these goals of safely managed sanitation. It wasn't to arbitrarily raise the bar higher. It was because the evidence shows that, limited services or improved facilities are not getting us that health impact. So I think we really have to take that to heart and really analyze what we're doing in our interventions. And I think that relates, as has been said, to the design and selection of technologies. And may I add service types? Nobody's mentioned container-based sanitation yet, but amazing innovative technology and service combination. So with the operation and maintenance, and also these institutional financing pieces, super important. And with that health lens, WHO, I need to hammer that home. So that's it from me.
Well, and because of where you sit, you're kind of in a unique perspective to comment on this as well too. Are you optimistic?
Yeah, I am. I think. Yeah, I mean, as Barbara says, I mean, people talk about it being terribly expensive, but it can be done. We, in the State of Sanitation report, we point to some really good examples of countries that have done it in a generation. And actually, it was interesting because some of them were through housing policy and other things that have come up. So we do need to have a really kind of open mind to trying new things. And yeah, history shows it can be done. So I'm optimistic.
It's good to hear, and there's a lot of smiles among the panelists, so I think there's broad agreement that there's still some optimism there. Well, this isn't the end of our conversation on safely managed sanitation. I really want to thank all of our panelists. I think there's been a great discussion. Please do, if you can stay around, sorry, Juliet, but for those who are in our time zone or are able to, please join the panel discussion starting in just a few minutes as we move from the science and the policy actions needed to support to the policy actions that are needed to support universal access to safely managed sanitation services. I think that'll be in room 3 starting at about 10:45. So thank you again to all of our panelists. I very much appreciate it, especially Malini, Juliet, who stayed up very late to be able to do this, and of course, Najib, Barbara, Klaus, and Kate. Thank you, as always, for your contributions. Very much appreciated. So thank you. Take care. Now, as Cody mentioned at our opening, we get to move on to something that I'm really excited about, and that is announcing the winners of the first Sanitation Workers Research Award. Malini mentioned this, but we all know the challenges. Some of us have seen it firsthand, but all of us have seen the pictures of sanitation workers involved in removing, transporting, and treating fecal waste. They're the backbone of delivering safely managed sanitation services and essential to reaching SDG 6. But those of you who have seen these workers in action know that there are risks involved, risks to their health, their safety, and their dignity. Every other week, we read a similar story of a worker entering a sewer or septic tank without any safety equipment and dying of asphyxiation. Often co-workers go behind to rescue him and put themselves at similar risks. Many of these workers are employed informally with weak financial and social security. Due to the nature of their work, they often face stigma and discrimination and remain ignored and neglected. Not an invisible workforce, but one that we choose to ignore. To protect these workers, we need concerted action at all levels. And to motivate this action, we need evidence. We need the data on how many workers there are, the nature of their work and their work conditions, the resulting health risks to them and their families, and their compensation. And we need evidence on what are the effective social, technical, and policy interventions that can make a difference in the work that they do. And to change this, we as researchers and academics, we need to work to address these knowledge gaps. We need to step up. And this is what's so exciting, I think, about the Sanitation Workers Research Awards that are about to be given out. They recognize outstanding research work that advances our understanding of the challenges and opportunities for supporting and protecting sanitation workers, and can be used to help build the political will for change, which we heard just a few minutes ago was so important to mobilizing the resources and catalyzing the political will that we need to achieve the SDGs. So with all that, I'll hand it over to Andrea Sueso from WaterAid, who will announce the awards on behalf of the Initiative for Sanitation Workers. Andreas, you on the screen? Perfect. I will give the floor to you.
Thanks, Aaron. I wanted to start honoring Faisal Masih and Nadim Masih. They are two sewer workers of Sargodha Metropolitan Corporation in Pakistan who sadly died yesterday midnight while cleaning a sewer. And one of their co-workers is in critical condition in hospital. And I just learned from our friends at the Superheroes campaign in Pakistan a couple of hours ago. So I thought it was worth sharing as a sad illustration of the points that you were just making, Aaron, and of the importance of this topic. As Aaron said, I'm presenting here on behalf of the Initiative for Sanitation Workers. That's a collaborative partnerships between WaterAid, ILO, WHO, SNV, and the World Bank. We have been working together on global advocacy on the health, safety, dignity, and rights of sanitation workers. Among other objectives, we want to encourage more research on the rights of sanitation workers. And as part of that, we're very happy to be here today and to collaborate with the UNC and have these awards hosted by their Water and Health Conference. The 2021 Sanitation Research Awards have two categories: Best Published Paper, that's papers that have been published in peer-reviewed journals over the past couple of years, and Best Original Research Abstract, that's abstracts that have been submitted to this UNC conference. We received many great submissions, which were evaluated by a panel of researchers, academics, and topics experts. And I'm honored to be about to announce the winners and to have them here today with us so they can share a snapshot of their research. I also will announce the runner-ups, but unfortunately we don't have enough time for them to join live today. So for the best published paper winner, I'm glad to award Mariam Sakut and co-authors for their excellent paper, Sustainable Sanitation Jobs, focused on the livelihoods of pit emptiers in Bangladesh. Please join hands in a virtual applause. Congratulations, Mariam.
Thanks, Andreas. Thanks a lot for this award, really honored. And yeah, I would like to thank my co-authors and supervisors, Sally Coward, Barbara Evans, and Danny Barrington. My paper basically trying to cover different types or different forms of sanitation work in Bangladesh, from manual to mechanical, from government to informal and private workers. What we are trying really to say is how complex is the situation, and especially with the interaction of caste system, social taboos, religion, formality, and legality of this job. So any attempt, I would say, to to support them should take into account these complexities and go beyond technology innovation, which the first panel was really talking about technology a lot. So yes, just to highlight the importance of centering the workers' needs regardless of technology, and look at things beyond innovation to ensure long-term sustainable and dignified jobs. It's seriously important to look at it as a central issue and not as a side project next to our sanitation, next to our way of trying to find new technology and improvements in sanitation. So yeah, that's basically it. Thanks again, and yeah, looking forward to hear the other winners.
Thanks so much, Mariam. Actually, the review panel wasn't able to agree on a single best paper. So we have another best paper award winner, and that's Kavita Wankade and co-authors for their fantastic paper proposing a framework for addressing occupational safety, which focuses on dislodging operators in 2 Indian cities. Congratulations, Kavita.
Thank you, Andre, so much, and thanks to UNC. I'm very honored to be receiving this award on behalf also of my co-authors, Mamta Gautam, Gayatri Sarangan, and Sriniti Sudhakar, and some of them are here in the audience. I would also like to actually take a moment to thank all the sanitation workers who were part of this study, because the study and research would not have been possible by them. Just a little bit about the research, like Andre said, it was about desludging operators looking at the safety issues in 2 Indian cities. And where it differed was that we used actually a systems approach and located the safety issue within a larger context. We also worked extremely closely with the sanitation workers, not only to identify problems, but also actually help come up with various solutions. We used the hierarchy of controls, which is very commonly accepted, and identified initiatives across the pyramid from elimination to PP. And here I just want to kind of second what Miriam said, that it was not only about technological innovation, like many of the initiatives that we came up with were about better access, irrespective of design, or even behavior change campaigns, which could change behaviors for clients. Lastly, the study actually located the study within the larger context of the informal nature of the sector itself, plus the vulnerability of workers' life and how these actually can inform sanitation measures. And the last thing I want to say about the paper that we have really emphasized about the tacit knowledge that the sanitation workers themselves have who've been in this profession for a while. And yeah, that's it. Thank you once more. Great to be receiving this.
Thank you, Kavita. Now for the best paper runner-up, congratulations to Rachel Pellets and co-authors for their paper Expanding Safe Fecal Sludge Management in Kisumu, Kenya, an experimental comparison of latrine pit emptying services. Remember, you can access the presentations and the papers of the awardees on the UNC website and announce on different platforms. But now on to the best original research abstract. I'm glad to announce the winner, Dr. Sally Coward, and co-authors for the research Losing Out on Improved Sanitation Work, which explores the challenges and pathways out of manual pit emptying for workers in Bangladesh. Congratulations, Sally.
Thank you very much, Andres, and everybody here at the UNC conference. Thank you so much for this wonderful award, which I accept on behalf of my 2 co-authors, Melisha Farzana and KM Faisal Naeem. A special thanks also again to the sanitation workers involved in the work and to WaterAid Bangladesh for hosting the research. So the abstract is based on 4 weeks of qualitative field work in Bangladesh in early 2020. It's part of a broader 2-year project on gender, caste and urban sanitation work, which I've been running at the University of Sheffield. The aim of the study was to further examine, building on Mariam's excellent work previously, the pathways out of hazardous manual pit emptying in smaller towns, among those who self-identify as Harijan, low-caste religious minorities. The 3 key takeaways I want to highlight from this research are that greater collaboration is needed between WASH, Labour and Dalit rights organisations to record data on deaths and injuries, to enforce labour laws and collectively lobby for anti-discrimination acts as many workers face ongoing discrimination. Secondly, we need an inclusive approach to FSM to ensure marginalised workers are not left behind in interventions, including lobbying for permanent job creation, incorporating long-term training initiatives rather than one-off trainings, and also transition plans to ensure that manual emptiers don't lose out on improved job opportunities. And finally, we can do more to support grassroots leadership and organisation among sanitation workers via unions, via cooperatives and associations to ensure that the demands of sanitation workers, especially from minority socio and economic groups, are really at the forefront of advocacy, policy and planning. So please do watch the talks, and it's a great honour again to have the award. Thank you very much.
Thank you, Sally. And finally, for the Best Original Research runner-up, congratulations to Rachel Sklar and co-authors for their work in Rwanda, evaluating occupational exposure and health risks during fecal sludge management. As said, please check out their work on the UNC website, and also you can search sanitation workers, #sanitation_workers on Twitter, on LinkedIn. And we will also share a link to the awards announcement in the passable chat box. So that's all the awardees. They will all receive an award certificate. They will get waivers for the next UNC Water and Health Conference, and an opportunity to have their work featured in the Initiative for Sanitation Workers online platform. Winners in each category will also get a cash award of $500, and original research awardees can also access support for publication in open access journals. Finally, let me thank all the researchers who submitted their work, the panel that reviewed the submissions, UNC colleagues that have supported us, and Kanika Singh from WaterAid, who worked tirelessly to make all this happen. Stay tuned. There are posters and presentations in this conference with sanitation workers research, and please join the Wednesday lunchtime session, Looking Deeper, a research agenda to advance health, safety, and dignity of sanitation workers. There is also a 3-day event planned for late November, the Sanitation Workers Forum, which will be a great opportunity for researchers, practitioners, and worker representatives to meet, share, and discuss. And you can find more information on Twitter if you search for Sun Workers Forum. Thank you very much, and back to Aaron.
Thanks, Andreas. Congratulations to Miriam, Kavito, and Sally. Really just some fantastic work, and we're so pleased to be able to play a role in elevating this issue. Thank you as well again to Andreas and to WaterAid and their partners for making this award possible and bringing attention to this critically important issue, as you've heard, right? Not a day goes by where we don't hear some of these stories. So just, it's wonderful that we can bring some attention to it and to the science that helps hopefully inform this issue and bring greater attention to it. So congratulations again to everyone. You can find all of these papers again in the presentations on the conference website. So please do go and check them out. As we wrap up, just a quick reminder that tomorrow's plenary again will be on the evolution of rural water supply. So do join us for that. And thank you again, once again, to all of our sponsors. So we'll be taking a short break and we'll see you all again in about 12, 15 minutes as we begin the side session. So see you in a few minutes. Take care.